About smart lipo, laser assisted lipo. What is the difference between
let me
laser,
explain you.
smart, and why would you, what is it, good or is it bad? Why would you do it or not?
Well, the liposuction is, I think, is the most frequent procedure now doing in whole worldwide plastic surgery, very close to the breast implant surgery, and it's a very good procedure when the patient knows that it's not the answer of the problem. Liposuction have to be thinking like it is a complement to the full treatment, and the full treatment implies a good food intake, exercise, a lot of things, and the liposuction is just a complement. Okay, it's based in some important things. One of them is that the cells that keep the fat is reproducing in number until we are about 10 years old. Okay, after that we will not have more cells. The cells could be bigger, the one we already have at the age of 10 years old, but it will not have more. That principle is very important because if we take these cells fat out from that area, it's very difficult that in that area is keeping more fat again. Can go to other places, but not in that area. And that's a very important concept for liposuction. And during this time, this procedure has some, they try to improve the result. How? Giving more technology to the procedure, you know? I remember that almost 15 years ago, they tried to put an ultrasound energy in the tip of the cannulas, you know, and was a disaster. Okay, why? Because we discovered different complications that we don't have before using that, you know. With that energy, if the doctors stay too much time in the same place, that energy can make damage to the skin under and make some burns, okay? It makes more expensive surgery because we need to pay the machines, okay? It is more, the surgery lasts more because we're using that technology. And with the time, do not show that really is a good option. Then is coming the external ultrasound technology. Before we make the liposuction, they put the ultrasound in the body, trying to burn the fat, and after they do that, they aspirate that, okay? And do not work well. Actually, my thesis from my residency is about that. It was publishing in an international review, and we showed that there's no difference. Because they say that the more important difference is the shrink of the skin using this. The skin retraction is more when you're using the ultrasound than if not. And we check that it's the same. After 6 months, it's the same. Okay. The last technology they want to get in this is a laser. They call the SmartLipo. I went in December of 2010. For me, it's the best congress of aesthetic surgery in the world in New York. And I went to that congress, and they show us the reviews and the scientific research about the SmartLipo of the company that they make that, okay? And really, it's a shame that the studies they show us scientifically is very poor. Few cases, they say they work. They show us. They spend like an hour explaining that during the Congress. They spend like an hour talking about that technology. And the feeling of the people, it was full. You know, it's like a 500 assistants and 150 couldn't get in the Congress. And all the same feel the same. Every time it's more frequent that the companies try to sell machines to some techniques that already work fine. And with the time, we will see the result, that is improving or not. If you perform a good liposuction with all the time you needed to take, with small cannulas, we normally use a 2 millimeter diameter only, very small ones now. With all the care you need to take, you can do a very good results. You don't need a laser liposuction. I think in the next year we must wait for the result of the procedure they tell us they are doing about the laser technology, but the findings I have seen and the congress I have assisted, they don't think that SmartLipo is going to work and it's not going to last too much time.
Okay.